MUAC tape is used for measuring which of the following? A. Height. B. Head circumference. C. Both A and B. D. Upper arm circumference. And the correct answer is D. Upper arm circumference. MUAC stands for mid upper arm circumference. MUAC tapes are predominantly used to measure the upper arm circumference of children, but also that of pregnant women, helping identify malnutrition. Injection technique shown in the image below is used to administer A. BCG, B. Measles, C. Hepatitis B, D. Japanese encephalitis. And the correct answer is A. BCG. The BCG vaccine is given by an injection just under the skin, usually on the upper left arm. Sometimes a test may need to be done before receiving the BCG vaccine. If there is a chance your child has already been infected with TB, the doctor will arrange for Montex test. Identify the strip shown in the image below. A. Combined OCP, B. Iron folic acid tablets, C. MDT, D. Dots. And the correct answer is C. MDT. MDT stands for multi-drug therapy. Multi-drug therapy, MDT, is used for the treatment of leprosy. Leprosy, which is also called Hansen's disease, is treated with a combination of antibiotics. Typically, 2 or 3 antibiotics are used at the same time. These are dapsone with rifampicin, and clofazimine is added for some types of leprosy. Hypnotic drugs are used to treat A. Psychosis, B. Sleep disorders, C. Alzheimer's disease, D. Parkinsonian disorders. And the correct answer is B. Sleep disorders. Hypnotics are drugs that are used to help people fall asleep. Doctors recommend and prescribe them based on the type of sleep problem they have. Hypnotic drugs are also called sleep aids or sleeping pills. A patient is admitted with a burn injury to both of his upper extremities. What is the total body surface area affected for this patient according to rule of 9? A. 9%, B. 18%, C. 36%, D. 27%. And the correct answer is B. 18%. The front and back of each arm and hand equal 9% of the body surface area. Entire left arm is 9% burns, entire right arm burns is 9%. That equals 18% of burns according to rule of 9. Largest lymphatic organ that filters blood is A. Thymus gland, B. Lymph nodes, C. Palatine tonsils, D. Spleen. And the correct answer is D. Spleen. This largest lymphatic organ is located on your left side under your ribs and above your stomach. The spleen filters and stores blood and produces white blood cells that fight infection or disease. Which of the following tool is used for measuring the flexibility of a joint? A. Dynamometer, B. Galvanometer, C. Glucometer, D. Goniometer. And the correct answer is D. Goniometer. A goniometer is an instrument that measures the available range of motion at a joint. The art and science of measuring the joint ranges in each plane of the joint is called goniometry. Which of the following disease gives lifelong immunity after attack? A. Typhoid, B. Mumps, C. Tetanus, D. Diphtheria. And the correct answer is B. Mumps. After an episode of mumps, one never gets the disease again, and the attack provides lifelong immunity. What is the other name of pap smear? A. Colonoscopy, B. Cervical cancer analyzer, C. Papa-Nicolau test, D. Cervixogram. And the correct answer is C. Papa-Nicolau test. A pap smear is used to screen for cervical cancer. A pap smear test is also called Papa-Nicolau test. The passage of fresh blood per annus usually in or with stools is called A. Hemoptysis, B. Hematochezia, C. Hematemesis, D. None of the above. And the correct answer is B. Hematochezia. Melena is the passage of black tarry stools, whereas hematochezia is the passage of fresh blood per annus usually in or with stools. Silicosis is caused due to inhalation of A. Asbestosis, B. Iron, C. Silica, D. Barium. And the correct answer is C. Silica. Silicosis is a long-term lung disease caused by inhaling large amounts of crystalline silica dust, usually over many years. Silica is a substance naturally found in certain types of stone, rock, sand and clay. Working with these materials can create a very fine dust that can easily be inhaled. Bandel's ring is also known as A. Physiologic retraction ring, B. Pathologic retraction ring, C. Pathological uterine ring, D. Both B and C. And the correct answer is D. Both B and C. Bandel's ring is also known as pathologic retraction ring or pathological uterine ring. Bandel's ring is a constriction between a woman's thickened upper contractile uterine segment and thinned lower uterine segment during delivery. Which of the following are drugs obtained from animal sources? A. Oils, fats. B. Hormones. C. Enzymes. D. All of the above. And the correct answer is D. All of the above. Many important drugs are derived from the animal sources. In most instances, these medicinal substances are derived from the animal's body secretions, fluid or glands. Insulin, heparin, adrenaline, thyroxine, cod liver oil, musk, beeswax, enzymes, and antitoxins sera are some examples of drugs obtained from animal sources. Identify the type of traction in the image below. A. Hamilton-Russell traction. B. Buck's traction. C. Balanced traction. D. Gallows traction. And the correct answer is D. Gallows traction. Gallows traction is a type of skin traction used to treat a broken thigh bone or hip dysplasia, that is hip dislocation. It is applied on children. The failure of uterus to return to its normal size is called A. Involution. B. Subinvolution. C. Protrusion. D. Retraction. And the correct answer is B. Subinvolution. The failure of the uterus to return to its normal size following childbirth is called subinvolution. Which one of the following graph is used for recording of maternal and fetal condition during labor? A. Labor record. B. Vital signs graph. C. Partograph. D. Progress graph. And the correct answer is C. Partograph. The partograph is a graphical representation of the progress of labor and of the fetal and maternal condition during labor. It is the best tool to help you detect whether labor is progressing normally or abnormally, and to warn you as soon as possible if there are any signs of fetal distress or if the mother's vital signs deviate from the normal range. Identify the following instrument. A. Thermometer. B. Fetal monitor. C. Jaundice meter. D. Pulse oximeter. And the correct answer is C. Jaundice meter. The jaundice meter is a small portable device that quickly and accurately measures bilirubin levels in the blood. This information is important for diagnosing and treating jaundice, a condition in which too much bilirubin causes yellowing of the skin and eyes. What do you call 5 twin babies? A. Quadruplets. B. Septuplets. C. Sextuplets. D. Quintuplets. And the correct answer is D. Quintuplets. Quintuplets refers to the birth of 5 babies to a mother in a single pregnancy. Ventriculoperitoneal shunting is a surgery used in the treatment of A. Meningitis. B. Hydrocephalus. C. Pleural effusion. D. Hydronephrosis. And the correct answer is B. Hydrocephalus. Ventriculoperitoneal shunting is a surgical procedure that primarily treats a condition called hydrocephalus. This condition occurs when excess cerebrospinal fluid collects in the brain's ventricles. Identify the nail disorder shown in the image below. A. Clubbing. B. Koilonychia. C. Melanonychia. D. Anonychia. And the correct answer is B. Koilonychia. Koilonychia is when your nails have an indented shape, like a spoon. Often spoon nails are a sign of iron deficiency. You are also more likely to have spoon nails if you have an autoimmune disease, such as lupus or poor blood flow to your hands or feet. The nurse is caring for an infant following a cleft lip repair. While comforting the infant, which of the following intervention should be avoided by the nurse? A. Holding the infant. B. Offering a pacifier. C. Providing a mobile. D. Offering sterile water. And the correct answer is B. Offering a pacifier. After cleft lip surgery, the use of pacifier should be avoided for the next 3 weeks. The use of pacifier should be avoided as it may interfere with the healing at the surgical site. Identify the procedure performed on a patient in the below image. A. Intubation. B. Colpotomy. C. Cricothyroidectomy. D. Tracheostomy. And the correct answer is D. Tracheostomy. A tracheostomy is a surgically created hole in your windpipe that provides an alternative airway for breathing. Urine sample for culture is collected from A. First urine. B. Last urine. C. Midstream urine. D. First and last urine. And the correct answer is C. Midstream urine. A midstream urine sample means you don't collect the first or last part of the urine that comes out. This reduces the risk of the sample being contaminated with bacteria from your hands the skin around the urethra, and the tube that carries urine out of the body. Paraffin bath is used for which of the following disease condition? A. Burns. B. Rheumatoid arthritis. C. Peptic ulcer. D. Chronic kidney injury. And the correct answer is B. Rheumatoid arthritis. A paraffin wax bath involves completely covering the hands or feet with molten paraffin wax. The warm melted wax helps relax muscles, reduce joint stiffness, and ease pain. While measuring blood pressure in upper arm, the chest piece of stethoscope is placed over which of the following arteries? A. Ulnar. B. Radial. C. Brachial. D. Axillary. And the correct answer is C. Brachial. While measuring blood pressure in the upper arm, the chest piece of stethoscope is placed over the brachial artery. Nurse should be aware that which of the following medication is never given directly intravenously as a safety alert? A. Dextrose. B. Ondansetron. C. Lasix. D. Potassium chloride. And the correct answer is D. Potassium chloride. IV potassium must never be given by direct IV injection. It must always be diluted in infusion fluid like RL or 0.9% sodium chloride.